Hey everyone, this is Theo Harvey, or the real Theo Harvey. If you've seen some of our branding out there on YouTube and Instagram, and there's some interesting things that are happening now that I think you need to be aware of as you prepare yourself, your staff, and your team ready for 2024 as we get to see all these different changes that are happening in the medical field. Disclaimer, just wanted to put that out there that look, what we're presenting is definitely something you want to check with your billing professionals, your practice admins, but this is just informational services that we're providing. So we're not providing any legal or other professional advice, as we have to be wary of what we communicate and training even. And so this is something you should be aware of. And also anything we talk about is disclosed also in the physician fee schedule. And you can see the link there below of what's possible. So let's get into it. So let's talk about the untapped opportunity for healthcare providers starting January 1st. Annual wellness visits. I'm sure many of you have heard about this and maybe even starting to do it. Basically, this is a versatile tool that addresses an array of preventative health measures. These annual wellness visits, especially for Medicare patients older than 65, typically, they're comprehensive. They can engage the patient to discuss like the care goals, things helping the patient think more holistically about their wellness. So they're very well important to do. But unfortunately, a lot of folks are not taking advantage of it. A lot of organizations don't take advantage of it. And there's many reasons we'll go into in a second why they don't. But this is something that can really help with identifying care gaps, helping create preventive screening schedules, guiding patient-centered care planning, facilitating conversations about advanced care directives. All that is available and it's reimbursable. Not much, but there is some reimbursement tied to it. Also, CMS is also adding other components, other type of surveys or questions that you can ask the patient. They have depression surveys, right, that you can go through every year with the patient. And also the new social determinants of health. This can be implemented twice a year. This S2H add-on to annual wellness visits pays roughly about $5 to $10 per patient, but it basically gives understanding of patients' other needs outside of healthcare, anything that influences the care of that patient. So social determinants of health could be things like transportation services, medication, getting access to medication that's reasonable and cost effective, having people help you at home for different things, maybe food insecurity issues. So there's all kinds of different things that go into the person's social determinants of health. And so now having this questionnaire is a start in the right direction that CMS is going in. And that's all going to be reimbursable. So take advantage of these programs, especially at the beginning of the year. This is a perfect time in January to have that conversation with patients when they come in, do their annual wellness visits, and then having that up to date helps drive a lot of other opportunities. So why do you feel a lot of practices don't do these things, right? And I think one of the things is awareness, not understanding that this is available and out there. And so if you are aware of it, probably the biggest thing is also workflow, established workflow, right? Understanding, do you have the software in place? Do you have the team in place? Do you understand what the documents that you need to fill out to ensure that you qualify for the reimbursement? And so making sure that's established and working with a vendor partner can help you with that is going to be key. And finally, a lot of times accountability is key to making sure these programs are successful, ensuring you have that mid-level ownership, having the nurse team or someone in more of an administrative role, understanding how many you're doing, what's your goals and targets, and making sure you keep adequate notes on what's going on with the patients so that you can pull them up. And that can drive a lot of other things with new remote care programs. The annual wellness visits, basically the foundation of how you can leverage that to do other things. So take advantage of that. See the reimbursement there. And I definitely see for January 1st, this will be something you want to plan now.
Hey everyone, I want to take the time to let you know how we can help you and your organization navigate the coming changes to your practices. Please join our monthly webinar on how virtual care programs will transform the management of your medical practice. In this informative webinar, you will learn our proven system on how not to miss out on any billable value-based codes, how to scale your team to handle new workflows without burnout, and the onboarding experience for value-based care programs that produce the best patient care. So if you want to learn more, click on the link below and sign up today.
Billing cycle management review. This is extremely important because it's shown time and time again that inaccurate billing can cause significant financial loss to physicians and their practices. We've seen practices lose an average of 5 to 10% of their revenue due to billing errors. That's correct. Delaying, not filing correctly, not following up on denials. All these go into that factor. And 5 to 10% of your revenue, in addition to, look, imagine this. You're already getting hit by inflation. So basically, your costs are rising, staff costs are increasing. You're getting hit also on your revenue, pushing down your reimbursement and your revenue coming in. Now, add on top another 5 to 10% in lost revenue because you're just not following, you may not be following the processes correctly when it comes to billing. That can really harm a practice when you're looking at adding all these up. And so with margins typically average anywhere from 3 to 5% for a mid-sized practice, a lot of this lost revenue can hurt them dramatically. So it's important to take that time and do an audit and understand what's going on. You want to make sure you evaluate current claims for timely filing, right? If you're Medicare, you have roughly a year to send it out. Typical Medicare Advantage or other programs or commercial programs, you have to do it in roughly 90 days. So you need to understand that those are going out consistently. You have a great biller, they understand that, but just verifying that and making sure there's any updates to your processes. Want to evaluate your denials for closure. So making sure you understand all your denials and what's happening, reviewing that consistently. And so that you understand why certain patients are being denied out. Also, you understand your current payer contracts, right? And we're at the end of the year, so that's going to probably start changing beginning of January. So understand exactly what your payer contracts are looking like so you can evaluate that and focus on that. And then finally, you want to research current patients' changes in insurance, right? You want to understand exactly what their insurance looks like and how they can prepare for the future. So these are some of the things to look through as you think about your patient programs and doing effective billing strategies for the future, which is always key. And then the alternative billing audits, right? You want to make sure you have maybe someone coming in from the outside, just looking at it from a different perspective. It's always good to have fresh eyes on a new perspective, see ways you may have missed or new ways of doing things. There's nothing wrong with that. I'm not saying obviously you have workflows that you establish over the years, but it's always good to have different perspectives. That's what medical discovery is about. When you have clinical trials or you have literature out there, new methodologies, right, are being pushed to the forefront every day, and understanding those methodologies you want to incorporate into your medical practice, right, to do and help for better patient care. Why not do the same kind of format, understanding new ways of implementing the business of your healthcare, right, with billing practices that make sense. You want to identify areas of improvement and then also recover lost revenue. So if there's things just sitting there, making sure you bill. We've seen when we've done our billing audits, patients can recover a couple of $1,000s that they were just sitting there that just didn't get billed out effectively. So simple things like that can really help you. And understanding getting that external billing audit would be in the right direction as you build out towards the future of your organization.